We've got a special guest tonight, and we want to make this an opportunity for Columbus and Bartholomew County to understand what's going on at the state level. So it's my pleasure to bring on stage Mr. Jim McClelland and Dr. Jennifer Walthall. Jim and Jen, come on. We spent the afternoon with Jim and Jen, and while it was incredibly valuable to us, and I hope equally as valuable to you, the thing I was really disappointed about was that Jim never acknowledged that I wore the same uniform as he did today. You know? Yeah.
But I did notice.
Yeah, okay, you did notice. Well, I noticed too.
I just wasn't going to say anything.
Yeah, okay, all right. So we've got about 20 minutes and then we'll wind this down. We're going to keep this really casual, and I'd like to start off with both Jim and Jen giving the audience an idea of the role you play in Governor Holcomb's administration, what you've learned over the last 15 months since you've been in these roles, and then after you both do that, we'll talk about your perspectives of what's going on around the state of Indiana. So Jim, why don't you start us off?
All right. Well, first of all, I just want to thank you, Jeff, for inviting us to be part of this and to be able to meet so many of the people who have been such who have played such leadership roles in creating what we have heard here tonight, making it all happen, and all the people who have been working with you on this. I think what you've done is just remarkable, and I know that this is just the beginning for what you're going to accomplish. You're going to have really, I think, tremendous impact. And I'm going to play a little bit off your slogan, and I'm just going to say, we know you can, and I know you will.
Thank you.
You got to get it done. My role was created by Governor Holcomb the day it was inaugurated, because he had decided to make attacking the drug problem one of his very top priorities, very serious about this. So he created this position that I'm privileged to hold. And my job basically is to coordinate, align, focus the relevant resources of all the state agencies that touch this issue in one way or another, and then to see how we might leverage the state's resources with those of other sectors: business, higher ed, healthcare, philanthropies, faith-based organizations, other community-based organizations. Try to bring the pieces together in ways that are going to give us the best chance for the greatest impact. Jen and I go all over the state. We see a lot of communities, and we see what's going on. I will tell you that what you're doing here is going to serve as a wonderful example for lots of other communities in this state. Not everybody can do what you're doing here or what you have done. Resources vary from one community to another, but everybody can learn from your experience. And so thank you for the role that you're going to play as a wonderful example, as well as for what you're going to be doing to help reduce a major problem.
Well, I think you had two questions. The first was, what's the role? And the second was, what have we learned in a year and a half? When I was appointed to be the secretary for FSSA last January, I called my mom to let her know. I actually was holding a position in the previous administration as the Deputy Health Commissioner for the Indiana State Department of Health, and actually met several of you in the room during my time as the Medical Incident Command for our Scott County HIV response. I was reappointed to that role by Governor Holcomb when he took office, and about 8 days later I got a phone call that said, I actually have something else that I want you to do. And so when I called my mom to tell her that I had moved to a different role, she gushed, as moms are supposed to do, and then there was a brief pause followed by, what is that? So FSSA is an extraordinary agency. I am privileged to have been in this space for a year and a half, working with Jim and other agency heads. What we did, and what we did in 1991, was we housed all of our social service deliveries under one roof so that we could see people holistically, not by program. And so we are the largest state agency across the state. Between state employees and contractors, we have about 7,500 folks that are out there doing the day-to-day work to connect people to the services that they need. That includes everything from healthcare delivery from Indiana Medicaid, which covers health insurance for 1.5 million Hoosiers, including the newly renewed Healthy Indiana plan to expand Medicaid coverage up to 138% of the federal poverty level, to the Division of Mental Health and Addiction, where the nexus of much of this work that we've talked about tonight really lives and breathes, all the way to early intervention programs like First Steps that does early intervention for 0 to 3 for kids who are at risk for developmental delays, and everything in between. And through the lens of looking across these programs, if I learned one thing, is that what I learned as a kid growing up in Valparaiso, Indiana, is actually everything that I needed to know to do this job. And that is that when you get up in the morning and you get ready to do whatever it is that you're supposed to do, and my mom had a list of those things on the door for us, and it ended with one thing, is go out and love people. And if we do that, then we're going to be fine. And though it wasn't necessarily stated as a slide on the presentation, that's what you're doing. And you have manifested your love for each other in the way that you've built your community and the way that you're delivering your programs. Now, FSSA doesn't necessarily have as our slogan, we love people, but we should, because we do. And it really should be evident in the way that we deliver our programming, that it's not the checkbox that we fill, it's the vigor with which we fill that checkbox. And I hope that you see that that is manifested not just in how I try to lead this agency forward, but in how we partner with each other, how we partner with you, and how we take all of the resources that we have so that every last person that needs them gets them how they need them, when they need them, and for as long as they need them. And that's my call to action for all of us, is to think about how every day when you get up and brush your teeth and think about what you're going to do today, that you fill whatever those spaces are with as much love as you have for the people that surround you. Because this... this is not an us versus them problem. This is a we problem. And we have the answers if we find them together.
Thank you. I'd like to ask each of you to comment on what you think the biggest achievements or most progress has been made in the last year from your perspectives.
Well, when we started tackling this a little over a year ago, we quickly learned, well, Jen already knew it, I didn't know it. I knew it was a big problem. What I had not realized was how complex it is and how many pieces there are to it. So we had to develop a strategic approach to how we were going to tackle it, so we didn't just end up playing whack-a-mole. And we did that. And we set some broad priorities, doing everything that we could to just help keep people alive. But then understanding that people with opioid use disorders have got to have treatment, and we didn't have nearly enough. And so expanding access, timely access to treatment, particularly medication-assisted treatment, has been a really top priority. And I think we've done a lot there. Yeah, and we also had some behind-the-scenes work that we needed to do. Improving the usability of Inspect, which is our prescription drug monitoring program. Now we're integrating, we launched an initiative to integrate Inspect with the electronic health record systems across the state. It just makes the system much more user-friendly, and is going to give doctors much more time, or prescribers much more timely access to the information that they need about their patients. So we did that. We have taken a number of initiatives. I'll let you talk about the Cures Act grant and some of the things that we've done there, but there's a long list, and a lot of what we got started last year, we're really now in full implementation mode, and we're going to continue to build on that. But it's moving at an increasingly rapid rate, I think.
I would say, just as a general theme, I think our biggest success in the last year and a half has been alignment. when you think about the different sectors that have to come together to get this done, and folks that have never really thought that they would interact with each other in any way, we're now on work groups together. So I see and feel, which is a good thing. It's not just a feeling, but a real reality of multi-sectors working together. And that's really manifested in things like our conference that we hosted for the first time last year that was Public Health and Public Safety, Combating the Opioid Epidemic Together. There's not a right or a wrong answer here where there's a public health approach and then there's a public safety approach and they're against each other. They're actually, we have to have it all, and we have to all learn how to speak the same language so that those tools actually function in concert with each other, and that's where we get to the end. I saw this really manifested beautifully. Last week I was in LaPorte County for their opioid report out, and they did this really incredible combination of data and then also a qualitative survey, so a survey of the community. And one of the questions they asked the community was, what do you think started or is the problem of this opiate epidemic? And the community response was in 3 themes. The first was that prescribers, doctors in particular, were prescribing too many opiates and that they were being diverted for things that they weren't meant for. That was number 1. Number 2 was that there was heroin trafficking from Chicago and Detroit coming into LaPorte County. And number 3 was that there was despair in the community because the economy was not strong and people didn't have hope for the future. And I couldn't have written that any better. And the perception of the community was absolutely correct, that we have a supply issue, and it's both licit and illicit, that require a public health and a public safety approach to combat, and that we also have to build economic infrastructure in order to get past this so that we can all thrive. It's not really about opiates at all when you get down to it. It's about reinstilling hope for the future in all of our communities so that we can recover together.
What I'd like to ask you, Jim, first, and I've got a second question for Jim. What are the biggest missing pieces? You know, where are we in terms of having a really good idea of what we need, but not capable yet of fulfilling that need?
I'll mention a couple of things. We have a huge need for more recovery support systems, and particularly recovery housing. It's been mentioned here prominently this evening. Big need. We've got to come up with a plan in order to be able to meet that need. And then doing more on the prevention side. We're making some really good headway in reducing opioid prescription rates, but we need to be doing a lot more to encourage the use of evidence-based substance abuse prevention programs, such as we heard about tonight. You're already on board with it. Life skills training is a great one. Purdue Extension is implementing, and some other organizations as well, implementing Strengthening Families curriculum in a number of counties now. That's a good program. Lots of evidence behind its long-term impact. So those are 2 areas where we've got a lot of work yet to do.
So I spend a lot less time sleeping than I used to, not because I'm busy, but because I'm worried about everybody. I have a couple million folks that I have to take care of, and I worry about what's going to happen to them. And so the gap for me is what I have to do, what I'm missing. And so one of the biggest things that we're thinking about and we're trying to tackle right now is something that is affectionately or not affectionately known as the cliff effect. And I'm going to tell you a story to illustrate that really quickly, because that's, I think, where our biggest gap is here. I have a gentleman who is a patient in a recovery program in Indianapolis, has been in successful recovery for a long time, and is doing extraordinarily well. So well that he got a job last fall, and he went to work at one of our local Lowe's, and he was loving it and was in an apartment and really doing a great job. He maintains his recovery through medication-assisted treatment. He's in therapy, and he also gets a monthly injection of a medication called naltrexone. That medicine is actually relatively expensive, but it's covered under Indiana Medicaid, and so that's how he gets his treatment. Over the wintertime, he unfortunately was subject to something called mandatory holiday overtime at Lowe's, which means that in order to compensate for the increased volume coming through retail, you have to work a little bit more. And what happened is that because he was working more, he made just a little bit too much money to qualify for Indiana Medicaid. And he called me and he said, Dr. Jen, I need to know what I am supposed to do. Because if I stop working, then I won't have a job anymore, and I'm really enjoying the independence that I have. But if I keep working and I lose my health insurance, I can't yet afford the $1,000 a month that it's going to cost for me to pay for my medication-assisted treatment out of pocket. And we worked and we tried to recalculate stuff and do all kinds of things, and I called the manager and all of these things, and we couldn't find a solution, and he had to choose between his life and his job. And I'm glad that he chose his life. He quit his job and he stayed on our Medicaid program, but we can't do that anymore. We can't have the cliff effect where I'm asking people to make those decisions every day. And so my pledge to you as we work toward filling those gaps that you asked about is that we actually make reasonable decisions in how we do that, and we help people find their way on that path, not through a cliff, but a gentle stair step, so that as you make your way forward, that you're not penalized for succeeding. And that's our pledge to you.
Thanks, Jen. Thank you very much. Jim, in an earlier conversation today, we talked about momentum, how it feels like to those of us that have been spending a great deal of time on this topic that there's some things starting to shift. I'd like for you to tell our community your thoughts on that.
Yeah. Well, we're starting to see some positive indicators various places around the state. And I will tell you, I kind of look at this as I'm going to use a freight train analogy. I know that's maybe a sensitive topic for
Mayor
some
Lemp
people
especially
around here,
likes that analogy.
forgive me if that strikes a wrong chord, but when a freight train is standing still, it takes a lot of energy to get it moving. And then as you get it moving, it's building up speed slowly. But then as you continue to increase speed, you're building momentum. And once you reach cruising speed, you got a lot of momentum, and you're going to be really hard to stop. You can still get derailed, but you're going to be hard to stop. And that's, we're picking up speed. You're doing it here. I see it other places around the state. We're picking up speed. We are going to make a serious dent in this problem, and we're going to do it in a whole lot less time than it took to create this crisis. And I'm confident of that. You know, and I see evidence of what I'm about to refer to here in this room, and I've heard it tonight. There's a quote from Dreamland, and I know a lot of you have read Dreamland. Let me show of hands. How many of you? So almost everybody here has read Dreamland. But one of my favorite quotes from Dreamland is when talking about this issue, nobody can do it alone. But no drug dealer nor cartel, you know what I'm going to say, can stand against families, schools, churches, and communities united together. That's what's going to end this thing, and you're well on your way.
Thanks, sir. It's been a long day for all of us, including the two of you. Thank you for your trip to Columbus. Any final comments?
Thank you for having us. It's been a wonderful day. It's been a wonderful experience. Thanks for what you're doing.
I can't think of anywhere else I would have rather been today. Thanks for having us.
Thanks. Well, let's give a round of applause to our guests. Thank you.